People who wish to lower their cholesterol levels are likely to find that making lasting changes to their diet and lifestyle is more effective than trying quick fixes. Lifestyle changes can sometimes lower cholesterol levels relatively quickly. People may notice the effects in as little as a few weeks. However, to see a lasting change in their cholesterol levels, a person will need to stick to their lifestyle adjustments and any medications that a doctor recommends to control the issue. What is cholesterol? Cholesterol is a waxy, fatty substance that the liver produces. In the body, cholesterol plays a key role in forming cells and breaking down some types of fatty acids. The body creates all the cholesterol it needs. Dietary cholesterol is the other source of cholesterol, coming from the foods a person eats. Cholesterol appears in animal foods such as meat, egg yolk, and full-fat dairy products. Regularly eating these products adds more cholesterol to the body and raises the levels of cholesterol in the blood. Additionally, some fats and oils may stimulate the liver to make more cholesterol, potentially increasing the levels even more. Cholesterol levels. High cholesterol levels increase a person's risk of heart disease and serious events, such as heart attack and stroke. Various factors play into a person's overall risk of disease, but lowering high blood cholesterol may help reduce that risk. How long does it take cholesterol to go down? People who need to use medications such as statins to lower their cholesterol should see their cholesterol levels fall quickly. These medications may work in a matter of weeks, and they generally work to a larger degree than lifestyle changes. However, because diet affects the levels of cholesterol in the body, doctors commonly recommend that people make changes to their diet and lifestyle in addition to taking medications. Making simple changes to the diet and lifestyle can help reduce cholesterol. These changes vary depending on how strictly a person adheres to their diet, as well as other factors, such as exercise and weight loss. Some dietary changes may cause minor reductions in cholesterol in as little as 4 weeks. Most people can expect to see the difference in a few months on a heart-healthy diet plan. How to lower cholesterol. Dietary and lifestyle changes and medications can all help lower blood cholesterol levels. For people who have dangerously high cholesterol, doctors will often recommend medications to help bring blood pressure down. The standard treatment generally begins with statins. These drugs help lower the amount of cholesterol that the body makes. They also reduce inflammation around cholesterol plaques. This reduces low-density lipoprotein (LDL) cholesterol, raises high-density lipoprotein (HDL) cholesterol, and lowers triglyceride levels. The American Heart Association (AHA) also note that statins are the only type of cholesterol-lowering drug that research has directly linked to a reduction in the risk of major events such as heart attack or stroke. Statins do have some side effects, which may be worse on higher doses. Some other medications may be required as well, depending on the person's underlying risk factors. Other medications may include resins. These drugs stimulate the body to get rid of excess cholesterol. Selective cholesterol absorption inhibitors. These help prevent the body from absorbing cholesterol. PCSK9 inhibitors. These lower LDL cholesterol by binding to proteins in the liver. Fibrates. These drugs target and lower triglycerides in the blood. Supplements such as niacin and omega-3 fatty acids may also play a role. A person should talk to a doctor to find a medication for cholesterol that works for them. Dietary and lifestyle changes. Dietary and lifestyle changes are key to making lasting changes in cholesterol levels. Although they do not produce results as quickly as medications do, a person may notice their cholesterol levels drop in just a few weeks or months if they stick to a healthful diet and lifestyle plan. Increase intake of plant foods. Plant foods are rich in vitamins and nutrients, and they lack cholesterol. Most plant foods also lack saturated fats, which may increase cholesterol in the body. A review published in Nutrition Reviews noted that people who ate vegetarian diets had significantly lower cholesterol levels compared with omnivores. The authors also noted that some targeted diets using plant foods might cause stronger effects. For example, a diet rich in soluble fiber, plant sterols, and vegetable protein sources, such as soy and nuts, reduced LDL cholesterol by an average of 28.6% in just 4 weeks. These effects continue over the long term. A review in Progress in Cardiovascular Diseases estimated that this type of diet reduces the 10-year risk of coronary heart disease by about 13%. People who need to reduce their cholesterol quickly can work with a dietitian to create a targeted diet plan. Increase fiber intake. While adding plant foods to the diet increases fiber intake naturally, it may also be helpful to take a fiber supplement or over-the-counter fiber drink to support the body. Fiber keeps the digestive system healthy and may help prevent the body from absorbing cholesterol. The AHA note that a high-fiber diet alone may reduce a person's cholesterol levels by as much as 10%. Avoid trans fats. Avoiding trans fats from foods such as fried foods, shelf-stable foods, and baked goods is important for cholesterol health. Trans fats are chemically processed and raise cholesterol levels in the body. Limit saturated fats. Saturated fats do not contribute to cholesterol directly. However, they activate the liver to produce more cholesterol. This may add to cholesterol levels. The AHA recommend limiting saturated fats to 5 to 6% of daily calorie intake. That would be 100 to 120 calories worth of saturated fats for a person who eats 2,000 calories a day. Quit tobacco. Tobacco smokers generally have lower levels of HDL cholesterol while having elevated levels of other risk factors, such as blood triglycerides. Quitting tobacco may help bring up levels of HDL cholesterol and balance the total cholesterol. Exercise. Regular exercise is an important part of lowering cholesterol because it may help bring up HDL cholesterol while lowering LDL cholesterol. Exercising also helps manage other risk factors for heart disease, such as helping with weight loss and strengthening the heart. It is important to note that these are long-term changes rather than quick fixes for high cholesterol. However, people who stick to these changes may see noticeable results for longer periods. People with high cholesterol are at an increased risk of heart disease and major heart events. Doctors may recommend medications such as statins to manage dangerously high blood pressure. A person taking these drugs may notice changes in their cholesterol levels in as little as a few weeks. Doctors will also recommend dietary and lifestyle changes to support healthy cholesterol levels. These changes may cause noticeable beneficial effects in a few weeks or months. However, these changes are not a quick fix. The best way to reduce cholesterol levels over the long term is to make lasting changes to the diet and lifestyle. A heart attack is a life-threatening event caused by a disruption in the blood flow to the heart. Knowing the female-specific symptoms of a heart attack could help a person seek medical attention sooner, which may save their life. Women are less likely to survive their first heart attack than men. This may be because the symptoms differ between the sexes. Women are more likely to have a silent heart attack or display unusual symptoms. Also, female biology creates unique risk factors for heart attack, as some diseases that increase risk, such as polycystic ovary syndrome (PCOS), are not present in male biology. Symptoms of heart attack in women. Many people expect a heart attack to come on suddenly. But research suggests that women experience symptoms for several weeks before a heart attack. A study published in 2003 of 515 women who had experienced a heart attack reports 80% of women had at least one symptom at least 4 weeks before their heart attack. Symptoms may be constant or come and go, and they may also disrupt sleep. It is vital for a woman who experiences any of these symptoms to seek help immediately, as heart attacks can be fatal, regardless of whether symptoms are mild or severe. 8 of the symptoms of a possible heart attack are: 1. Chest pain. The most common symptom of heart attack in both males and females is chest pain or discomfort. It may be described as tightness, pressure, squeezing, aching. However, women can experience a heart attack without having any chest discomfort. Some 29.7% of the women surveyed in the 2003 study experienced chest discomfort in the weeks before the attack. Also, 57% had chest pain during the heart attack. 2. Extreme or unusual fatigue. Unusual fatigue is often reported in the weeks leading up to a heart attack. Fatigue is also experienced just before the event occurs. Even simple activities that do not require much exertion can lead to feelings of being exhausted. 3. Weakness. Feeling weak or shaky is a common acute symptom of a heart attack in a female. This weakness or shaking may be accompanied by anxiety, dizziness, fainting, feeling lightheaded. 4. Shortness of breath or heavy breathing without exertion, especially when accompanied by fatigue or chest pain, may suggest heart problems. Some women may feel short of breath when lying down, with the symptom easing when they are sitting upright. 5. Sweating. Excessive sweating without a normal cause is another common heart attack symptom in women. Feeling cold and clammy can also be an indicator of heart problems. 6. Upper body pain. This is usually non-specific and cannot be attributed to a particular muscle or joint in the upper body. Areas that can be affected include neck, jaw, upper back, or either arm. The pain can start in one area and gradually spread to others, or it may come on suddenly. 7. Sleep disturbances. Difficulty getting to sleep and unusual waking may be issues before a heart attack. Almost half of women in the 2003 study reported issues with sleep in the weeks before they had a heart attack. These disturbances may involve difficulty getting to sleep, unusual waking throughout the night, feeling tired despite getting enough sleep. 8. Stomach problems. Some women may feel pain or pressure in the stomach before a heart attack. Other digestive issues associated with a possible heart attack can include indigestion, nausea, vomiting. Heart attack. Post-menopause. The risk of heart attack increases due to falling estrogen levels after menopause. Post-menopause heart attack symptoms include pain or discomfort in the arms, back, neck, jaw, or stomach, rapid or irregular heartbeat, severe chest pain, sweating without activity. Risk factors. Risk factors for a heart attack in women include age. Those aged 55 years or older are at greater risk of heart attack. This may be because hormones provide some protection from heart disease before menopause. Family history. Those with a male relative who had a heart attack by the age of 55 years old, or a female relative who has had one by 65 years of age, are considered to have a family history of heart attack and are at increased risk. Health status. Certain markers, such as high blood pressure and high cholesterol, increases the risk of heart attack in both males and females. Medical conditions. Those with conditions, including diabetes, obesity, and autoimmune disorders are more likely to have a heart attack. Diseases such as endometriosis, PCOS, or a history of preeclampsia during pregnancy also increase risk. Lifestyle choices. Using tobacco or stimulant drugs, for example, cocaine or amphetamines, a sedentary lifestyle, or high levels of stress will all increase the risk of heart attack. When to see a doctor. The British Heart Foundation recommend all women over 40 years of age have regular checks with their doctor. This helps identify risk factors early so that they can be treated. Early intervention reduces the chances of a cardiac event. Anyone who notices the warning signs of a heart attack, such as the following, should see a doctor immediately. Unusual fatigue, shortness of breath, upper body pain. A doctor will note symptoms, check blood pressure and heart rate, and may order blood tests or use an electrocardiogram (EKG) to see the heart's electrical activity. When to call emergency services. Anyone who suspects symptoms of a heart attack should call emergency services immediately. Only 65% of women would call emergency services if they suspected they were having a heart attack, according to a 2012 survey. Emergency treatment can save lives. Anyone noticing the following symptoms should call an ambulance immediately, especially if the signs are present for 5 minutes or more. Chest pain or discomfort. Pain in the upper body, including arms, back, neck, jaw, or shoulder. Difficulty breathing, dizziness, extreme weakness, indigestion or heartburn, nausea, rapid or irregular heartbeat, shortness of breath, sweating, unexplained anxiety, vomiting. Prevention tips for better heart health include going for regular health checkups with your doctor, taking steps to manage other health conditions, including high blood pressure, high cholesterol, and diabetes, Quitting smoking and avoiding tobacco in any form. Heart disease risk reduces by 50% just 12 months after someone quits smoking. Not using illegal drugs, especially stimulants, such as cocaine and amphetamines. Losing weight if overweight. Engaging in at least 30 minutes of aerobic activity, such as walking, every day. Eating a balanced diet and visiting a dietitian if necessary for dietary advice. Takeaway: a heart attack is a serious and potentially fatal medical event that requires emergency treatment. Women tend to display different heart attack symptoms than men. They also have additional risk factors. There are many steps women can take to reduce their risk of a heart attack. An awareness of the symptoms of heart attack, especially in the weeks before the event, can also improve outcomes and prevent complications.